Miss MS is a 20-year-old female with complaints of milky discharge from her breast. Patient reports that the symptoms started about 5 months ago. Patient states that she noticed the discharge when she would take her clothes off in the evening. Patient denies pregnancy. Patient reports that she has been on a depot shot for the past year. And patient states that she has not been sexually active in over 8 months. Patient reports that her last menstrual period was January 2024. Patient reports that her periods are abnormal and they're typically heavy. Patient denies pain at this time. Patient has a history of anxiety. Patient denies any surgical history. Patient reports that she's not currently on any medication. She takes a women's multivitamin daily. She reported that she got off her anxiety meds about 6 months ago. Patient reports that she went to therapy and learned other coping skills so she didn't have to take any medication. Patient denies any drug allergies. Patient's mother has a history of type 2 diabetes that is well controlled. Patient's father has a history of hypertension that is also controlled. Patient denies any tobacco, alcohol, and recreational drug use. Social history. Patient is in her second year of college. She's single, no kids. She works part-time at Hobby Lobby. Patient reports that she does not have any siblings. Patient states that she loves to hike for fun and read. Patient reports no current stressors in her life at this time. Patient denies depression and SI. Patient also denies any abuse. The review of symptoms were all negative. Her vital signs were within normal limits. Her blood pressure was 128/72, respiration 16, height 5'3", weight 185 pounds, BMI 32.88. Patient is a well-developed obese female. She's alert and oriented. No acute distress noted at this time, and she converses well and appropriately with provider. Her skin is warm and dry. Patient has milky white discharge from breast bilateral upon manual expression. Neurological, her cranial nerves 2 through 7 are grossly intact. HEENT, her head is normal cephalic and atraumatic. Her eyes are perla. Cardiovascular, S1 and S2 present. No murmurs, no rubs or gallops. No peripheral edema noted. Respiratory, no wheezing, rales, or rhonchi. Respirations are even and unlabored. Her abdomen is soft. No garden or rebound. Assessment. Abnormal nipple discharge can be linked to hormonal changes and common changes in the breast tissue. Today, patient will have labs drawn for pregnancy, thyroid, and prolactin levels. Patient will follow up in 1 week to review test results and to do other testing if necessary. Okay, so some differential diagnosis for nipple discharge. It could be a papilloma. A papilloma is non-cancerous. It's a tumor in the milk duct. I don't think it's a papilloma because it usually affects a single duct and it does have bloody discharge. Patient does not have any bloody discharge. She complains of only milky white discharge. Hypothyroidism. It presents with milky white discharge that's not related to pregnancy. Hypothyroidism can cause elevated levels of prolactin, which is what she's going to be tested for today. Pregnancy. It does present with milky discharge that is normal with pregnancy and breastfeeding. I don't think patient is pregnant because she has been on the depot and she states that she has not been sexually active for over 8 months. And patient, she denies any other symptoms of pregnancy. Patient will report back in approximately 1 week to discuss her final diagnosis, to Gorba Labs, and we will order more tests if necessary. Thank you.